A very warm welcome to every one of you. This is Henry of the Smart RN channel. In our video today, we are going to look at the diagnosis and management of urinary tract infections as well as the nursing intervention when caring for patients with urinary tract infection. So when a patient approaches a healthcare provider with a UTI, and after the healthcare provider has gathered some health history information from this patient, he will go ahead and use various methods to try and diagnose this UTI. Now, one of the methods is what we call urinalysis. In urinalysis, the healthcare provider will require the patient to provide a urine sample. This urine sample will be sent to the laboratory where it will be subjected to various tests to try and establish if we have white blood cells, red blood cells, nitrous, or even bacteria. Now remember, if there is bacteria present in urine, it converts the nitrates into nitrite. So the healthcare provider will try to look for one or more of these things in the urine sample, and their presence is going to point towards the presence of a urinary tract infection in that particular patient. We also have urine culture. In urine culture, they grow and identify bacteria in that urine sample. So they will put the urine sample in a petri dish in the laboratory, and then they will provide conditions which are necessary or which are ideal for the growth of bacteria. So if bacteria is present in that urine, it will start growing and spreading. Now healthcare providers will identify that bacteria, and then they will use that bacteria to identify what are the best methods of treating that particular infection. But I wanted to point out something here. In most cases with an infection, even before the healthcare providers can identify the bacteria, they normally prescribe what we refer to as broad spectrum antibiotics. These are antibiotics that are not aimed at treating any particular bacteria. They can treat any type of bacteria. So healthcare providers at the beginning, once they have collected the sample they require, for example, once they have collected the urine or once they have collected the blood or any sample they need, then they will go ahead and prescribe broad spectrum antibiotics until the time when they identify that bacteria. Then they will be able to prescribe a particular antibiotic which deals with that identified bacteria. So in urine culture, they grow and identify bacteria in the laboratory, which helps them to identify what are the best methods of treating that infection. Now we also have recurrent UTIs. Recurrent UTI is a situation whereby a patient has 2 or more UTI episodes within a period of 12 months, or he may have 2 UTI episodes within a period of 6 months. This is a recurrent UTI. Now, recurrent UTI may be as a result of structural problems in the urinary tract. So, structural problems, for example, if a male has an enlarged prostate, the prostate could obstruct urine, and this urine, stagnant urine, will become a fertile ground for the growth of bacteria. So they may try to find out if there is an enlarged prostate that is causing this stagnation of urine. We may also have outpouches like diverticula. Diverticula normally provide a place where urine stagnates in the urinary tract. So in case of recurrent UTIs, healthcare providers will suspect a structural problem in the urinary tract. So they resort to the use of imaging to view that urinary tract. So we have imaging methods like MRI, we have CT scan, we also have ultrasound. These methods, and especially CT scan, can be used together with the contrast dye unless it is contraindicated in that particular patient. But remember, they always look at the kidney of that patient before they decide to use contrast dye, because it's normally very nephrotoxic. So these methods will be used to view the urinary tract and try to identify if there is any structural problem which is contributing to recurrent UTIs in that particular patient. We also have cystoscopy. Cystoscopy is where a camera referred to as a cystoscope is used to view the urethra and the bladder. This is a small camera which is attached to a flexible tube. So it is introduced into the urethra and moved up the bladder. And as they move it, they visualize that urinary tract section to try and see if there is any area that is contributing to recurrent UTI in those patients. So healthcare providers can use imaging and even cystoscopy to check if there is any structural problem that might be causing recurrent UTIs in this patient. When it comes to management, antibiotics are the medications that are used to manage urinary tract infection. Just like any other infection, antibiotics are the most commonly used medication to manage UTIs. Now, we may have a simple UTI or a complicated UTI. A simple UTI is either that's UTI that is just found in the urethra or that has gone into the bladder and has not caused so much problems to this particular. It may even be the first UTI in that particular patient. But a complicated UTI is one that involves even the upper urinary tract. It involves the ureters and even the kidneys. That's a complicated UTI. So in a simple UTI, healthcare providers normally prescribe Bactrim, ceftriaxone, and cephalexin for the treatment of that UTI. But in complicated UTIs, healthcare providers resort to the prescription of fluoroquinolones. Remember, fluoroquinolones are not commonly used in cases of simple UTI. This is because their risks normally outweigh their benefits. But when it comes to complicated UTIs, healthcare providers may prescribe fluoroquinolones like ciprofloxacin and levofloxacin to manage that complicated UTI. Another way of managing UTI is by dealing with the pain. So we use analgesics to try and reduce pain experienced by this patient. Remember, we said that pain is one of the hallmarks of a UTI. These patients feel a lot of pain when they are passing urine. The reason is because the urinary tract is inflamed. So when urine passes over those inflamed areas in the urinary tract, these patients feel a lot of pain. So analgesics, and especially phenazopyridine, is used to manage that particular pain. When it comes to nursing interventions, there are a number of things that nurses do as they care for patients with urinary tract infection. One is assessment. Nurses are constantly assessing these patients from the beginning and during the course of treatment. So they are collecting both subjective and objective data. For example, they look for the signs and symptoms of UTI in this patient. Are they experiencing dysuria? Are they having urinary urgency? Are they having urinary frequency? Are they having infectious signs and symptoms? For example, are they having fever? That's elevated temperatures. Are they having chills? Are they experiencing pain? You have just said pain is one of the hallmarks of UTI. So they keep on assessing for all these subjective and objective data during treatment. This is very important. The assessment is continuous so as to be able to identify whether the treatment is being productive. If the treatment objectives are being met, then these signs and symptoms are going to reduce in the patient. But if the treatment continues and the patient continue experiencing these signs or even these symptoms become more worse, that means that the treatment methods are not being productive, or they are not working as they should. So the assessment, the continuous assessment, is to find out whether the treatment is meeting the goals. Then we also have reviewing of lab values. Nurses are constantly reviewing lab values. Remember, we said when a patient goes to the healthcare provider, they get the urine sample that's going to be sent to the lab. Also, they also get blood samples, and that's at the beginning. Then during the treatment, they also keep on drawing labs from this particular patient. So nurses must review the lab values to see whether treatment methods or the treatment of this patient is effective or not. The nurses manage pain. And as we have said, they manage pain by use of analgesics, or they can manage this pain. Now, we have said nurses can administer analgesics like phenazopyridine, but there are other non-pharmacological methods of managing pain. For example, we have distraction. These patients can be distracted by use of maybe watching television, listening to music, reading a storybook. That is distraction. We can also have hot compresses. Those are non-pharmacological methods of pain management. So nurses are constantly managing pain in this patient by using analgesic as well as the non-pharmacological methods of pain management. Then administer antibiotics. Healthcare providers are going to prescribe antibiotics. At the beginning, they may prescribe broad-spectrum antibiotics. But after identifying the bacteria, they prescribe particular antibiotics for dealing with that kind of bacteria. So it is the work of the nurses to administer these antibiotics on time and also ensure that these patients complete a whole dose of those antibiotics. Remember, one of the major important things about antibiotics is that you must complete the whole prescribed dose. Even if you start feeling well after just taking part of that dosage, you must continue and complete the whole of it. This is just to prevent you from becoming resistant to that particular medication. Another thing is that encourage these patients to increase fluid intake. Nurses should encourage patients to increase fluid intake. Increase in fluid intake helps to increase urination, and increased urination helps to wash our urinary tract of any bacteria. So the more you pass urine, the more you wash out this bacteria and the more you get better. So increased fluid intake in this particular patient is very, very important. Another important thing done by nurses is teaching. Nurses provide information. They provide a lot of information both to the patients and even to their families. What are they teaching about? One, they teach these patients to complete the antibiotics course. We have just said that it's very important to complete the whole course of antibiotics. Two, they teach these patients signs and symptoms of urinary tract infection. They teach these patients to increase fluid intake. We have just said that increased fluid intake increases urination, and increased urination helps to wash our urinary tracts of any bacteria. Treat these patients to void regularly. It is very important to urinate regularly. Keep a regular routine of voiding, because as you have just said, voiding helps to wash our urinary tract. At the same time, it prevents stagnation of urine in the urinary tract. Remember, I said that stagnant urine is a ground for the growth of bacteria. So void regularly. So even at times when you don't feel like voiding, just try to go and void, so to pass urine. Or when you feel like voiding, do it immediately. Do not postpone, because if you postpone, you are just creating ground for growth of bacteria. So nurses teach patients to void regularly. They also teach them to void before and immediately after intercourse. This is just to help wash out any bacteria that could have been introduced into the urinary tract. Nurses will train or teach these patients about non-pharmacological methods of pain management. We have just talked about massages, we have talked about relaxation, we have talked about guided imagery, distraction. All these are methods that patients can be taught to use or to employ when they are feeling pain. So nurses teach patients about the non-pharmacological methods of pain management. Very important, our female patients. Remember, we said that females are prone to urinary tract infection, and we said they stand higher chances of contracting a UTI, and we saw the reasons for that. Now, when it comes to a female patient, nurses should teach them to wipe from front to back. So this just prevents introduction of bacteria into the urinary tract. Teach our female patients to reduce or to avoid bubble bath. Teach them to avoid perfumed feminine products, and teach them to avoid the use of synthetic underwear. Remember, we said that synthetic underwear traps moisture, and trapped moisture is ground for growth of bacteria. So teach our female patients to avoid the use of synthetic underwear. They should also avoid tight underwear, because that's a ground for growth of bacteria. Instead, they should consider using cotton underwear, which does not trap moisture, and as such, it doesn't provide ground for the growth of bacteria. So these are the methods, or these are the interventions that nurses can actually undertake when caring for patients with urinary tract infection. So that brings us to the end of this video on the management and diagnosis of UTIs, as well as the nursing intervention. So remember to drop a comment, like this video, share this video, and if you have not subscribed, please, I urge you to subscribe to this channel. From here today is a goodbye.